My name's Claire, I'm one of the midwives at Cramlington Hospital. I work between both the birthing centre, the postnatal ward and the pregnancy assessment unit, so you might see me anytime you come in to have your baby. I'm just going to talk to you a little bit today about birth plans and how to create your birth plan. There's a wee birth plan template on your notes on page 36. Your midwife will discuss this with you at either 36 weeks or 34 weeks of your pregnancy. The NHS Choice website also has a really good template and information about how to create your birth plan and what to put in it as well. Just things to include in a birth plan. We describe it more as birth preferences about what you would like to happen in your labour. Obviously, labour can change very quickly, and we just want to make sure that we're doing everything that we can to facilitate your labour the best way we can for you. So things to think about is who you want to come with you to labour, whether that's going to be your partner, your mum, a friend, anybody who want to come. So at the minute you can have one birthing partner with you the whole way throughout your stay, and you can have another second birthing partner come in from when you're in established labour until you deliver your baby. The second thing I want you to think about is what sort of monitoring you like to have for baby, whether that be that you prefer for us to listen in the baby, or whether we'd like be happy for us to continuously monitor your labour, as well as applying a little FSE clip in case we can't monitor baby's heart rate efficiently or effectively. We will be able to do this and discuss this with you when you come in to have your baby, and we will also talk to you about this in further videos throughout this week class. The third thing we would like to speak about as well within your birth plan is what pain relief options you would like to use for when you are in labour. So we have pharmacological and non-pharmacological methods, and we'll have another video on this as well. We would also like to know what you'd like to do when baby is born, whether you would like to know what you're having, whether you'd like to just find out what you're having yourself, for your partner to tell you, for us to let you know, if you would like some skin-to-skin contact when baby is born, and if your partner would like to cut the cord. So we'd also like to know what sort of delivery you would like for your placenta, whether that be physiological or active management. Again, there's another wee video describing both methods in this week class. Next, we would also like to know whether you'd be happy for your baby to have vitamin K when baby is born, and also what sort of contraception you would like to use postnatally. The antenatal period is a really good time to think about this, as following having your baby, life gets a bit hectic and everything revolves around you and your new family. So thinking about that now, there's a wee section on your birth plan as well within page 36 about what sort of contraception you would like to use. We will talk about this in the postnatal section of our wee antenatal classes, but just something to think about in the meantime. Any questions or concerns about a birth plan, you've got your community midwife. You can ask her any time at any of your appointments, and you've also got NHS choices. We'd also like you to know that if you have any personal, cultural or religious beliefs or wishes for when you're in labour or following delivery, to just document those on your birthing plan as well, as we'd be very keen to get those included within your stay with us at Cramlington.